All right, everyone, Chapter 1, a little introduction to what we will learn throughout the course. And each one of these short videos from me will more fully explain a concept, maybe answer any questions you might have related to things that pop up in the chapter. It won't cover everything that you read or cover in your assignments on a chapter, but it will zero in on some concepts that I just want to highlight a little bit. All right, so our definition for interviewing: basic process for gathering information, problem solving, and advice giving. Interviewers could be people involved in these different types of professions. So guidance and counseling staff, medical personnel, even business people, and a wide variety of helping professionals. So as mentioned in the course introduction and description, skills learned throughout the course are applicable to multiple different contexts where skills related to communication are going to be necessary. So let's look at counseling first. Counseling is more intensive and personal than interviewing in general. Counselors help people typically with normal problems and or people who would like to pursue specific opportunities in their life. So career counseling might be a subtype of that, where people would like some strategies to pursue steps toward their ultimate career goals, or try to understand what career would be the best fit for them. If we break down counseling, we can see that obviously there's going to be a connection with psychology, but also connections with social work and psychiatry. Now, psychiatry is a little bit less extent. Psychiatry is the medical side of psychology and treatment. Oftentimes people contact me as a psychologist when they're looking for services and they would like me to prescribe medication, which I can't do because I'm a psychologist and not a psychiatry professional. So psychiatry is more medical. They will be able to prescribe medication. And so they do a bit of counseling, but not as much. And the last example on the slide, pastoral counseling, religiously based counseling. So psychotherapy is more intense than counseling. So we see we're zeroing in a little bit more related to these skills. And it focuses on deep-seated personality or behavioral challenges. Even within psychotherapy, I'm saying counselors, but psychotherapists would be probably a more helpful term in this case. Will use the skills that we'll cover in the course, like active listening, paraphrasing, summarizing, the types of questions we'll cover, and how to ask them. All those things they will be attending to in psychotherapy sessions as well. Okay, so we have a very daunting pyramid here. And let me make sure I'm in a good spot. I feel like I'm covering up something. Let me go here. Aha. All right, so we have a pyramid to help us understand micro skills in a hierarchy. Micro skills are the skills, are sort of like a umbrella term for the skills that we're going to be covering related to communication in the course. So at the bottom of the pyramid, we have multicultural competency, ethics, neuroscience, positive psychology, and resilience. And if you don't have a sense of what those things mean now, we will definitely hit on it throughout the course, and you'll read more about it in your text and see these things come to life in the videos that you watch. And hopefully you'll be able to exhibit some of these aspects of these in the videos that you upload and do yourself. The next layer of the pyramid, we have attending, empathy, and observation skills. And you can read a little bit here as to how this is broken down, but anything from body language to visual eye contact, the tone of voice, and all of that happening in a culturally and individually appropriate context. So when counselors or psychotherapists are meeting with clients, they're engaging in these types of communication, even without words, right? The nonverbals, and doing that in attendance to the particular needs and presentation of their clients. Sometimes we'll use clients, or we might use the word patients. We're talking about psychotherapy, persons who seek out psychotherapy. All right, now we have the basic listening sequence, and this BLS acronym you'll see a little bit later in the course. This accompanies what we've already talked about, but also the verbal portion. So questions, encouraging, paraphrasing, summarizing, observing, and reflecting feelings. So these would be things that the counselor or psychotherapist would utilize, particularly in their speech, their communication with clients. And don't worry, we will cover these. We'll have whole chapters on these things, so you'll get a sense of what they are and how to use them for yourself. And we have the 5 stages of the counseling session. We have a chapter on this as well, and how to use these listening skills. And you can see the 5 empathic relationships, story and strengths, goals, restory, and action. Moving up on the pyramid, we have influencing clients' actions and decisions. So these are things that we hope to see covered after we've met the basic needs or the foundations of the pyramid. So we can only give like psychoeducation or stress management recommendations, be able to reflect meaning with clients or reframe what they're bringing to us, confront them in an empathic way. We can only do those things after we've mastered being able to listen, right? And communicate the way that we listen, non-verbally and in giving feedback. And then we're getting toward the top of the pyramid here. We see skill integration and determining personal style, which is the last, it's chapter 15 of the book. But my sense of this is that you'll be infusing your own personal style throughout as you're navigating these skills covered in the course. And then skill integration is just putting it all together. All right, let's see how we're doing. Oh, I have to move myself again, back down here. Okay. Micro skills, so back to that keyword here. That's going to be an umbrella term for all of the skills that we're going to be covering in the course. So a 5-step model for micro skill development. Number 1, defining the skill, its central features and purpose. So why would we need to be able to ask appropriate questions at different times in an interview? Number 2, observe the skill in action. So I will be able to observe the skill when you practice it, and you will be able to observe it when you're watching those videos that are embedded into each module. You get a chance to see someone doing the skills in different role plays. And then 3, learn the skill and its implications. So obviously, as you're doing your reading and you're doing the activities within each module to check for understanding there, we'll get at this step of the model. 4, practice the skill in a role play. And again, you're going to be uploading these and I'll be able to see them and give you direct feedback. And the 5th final step is plan for generalization. So after you receive my feedback, integrating it into subsequent role plays that you will upload into Canvas, and I can give you feedback on that generalization. I'm moving around, aren't I? And I go here. Let's go here. Yeah, okay. So here's a little bit more on those 5 steps that I've just went through. We have a warm-up, so focus on a single skill and identify it as vital part of the interview. Number 2, view a DVD or observe a live demonstration, and you will see videos of role plays throughout the course, throughout each chapter. Read, you'll have access to the chapters to read them, to know in a different way what the skill looks like, sounds like, to conceptualize it in a different way. Practice, you'll be doing your own uploads of videos, and I'll be able to give you feedback on that. And generalize, as mentioned before, putting it all together. We have real world in quotations, but as you practice, you'll be able to see those when you do your videos. It is very applied, so you'll have like a situation in which you are to be using a certain skill, and so that's supposed to give you that real world exposure in a sense. Okay, let's keep going. We're almost done. Oh, okay. So the good thing about trying communication differently is that we can expect results from that communication to be different than maybe how you've communicated before in the past. Practice is essential. As with most things, practice makes close to perfect. Right? The more you do it, the more you feel comfortable. Multicultural differences are real. We'll be infusing that throughout the course in our understandings of how multicultural identities and intersections impact communication. Different theories have different patterns of skill usage. So depending on the theoretical orientation that you approach psychotherapy session with, now these may be words that you've never heard before, but throughout the course and the reading, you'll get a sense of them. Each theory has its own views of use of micro skills. And cultural intentionality prepares you for the unexpected and enables you to flex another micro skill. Another micro skill, flexibility, really. So the people that you're working with or role playing in your uploads, that you'll be attending to those things and the different backgrounds that the people are coming from. And then using the feedback. Feedback is so important to shape your future interactions. All right, this is another model of understanding and approaching communication. I'm not going to go too far into depth with it. I think I'm running out of time on this video. And we'll just spend a little bit more time here. Last slide. So focusing on empathic relationships, we're going to spend some time just on empathy and what that looks like. Number 2, identify the story of the client and their strengths. So being an active listener, being able to identify those things that are important for the client and utilize them later on down the road when we're thinking about treatment planning. Being able to agree upon goals with a client. Restory, so generate new ways for the client to see and talk about themselves. This is sometimes called reframing, but restory here. Sometimes there needs to be a cognitive shift, right, for people, and that's a big part of counseling or psychotherapy. And the 5th one, action, help the client bring new ways of thinking and being into action, right? Let's not just stop with the talk. Let's see things, some actual behavioral changes along the way. All right, so this is signing off for Chapter 1 mini lecture, and you'll see me again later in this module for Chapter 2 for another mini lecture.